All right, Bob. Next question directed at Bill Graham.
We would seem remiss not to touch on the turmoil that's going on in our mental health system. The recent Mercer report on the mental health system recommended that the number of local management entities, the LMEs, be reduced, that services be consolidated into 3 to 5 regions, and a central management entity created. All this seems to take us back to a setup similar to what we had several years ago. Given that many rural areas, like ours, are already suffering a lack of adequate providers, would you support the recommendations of that study?
Probably not. It sounds like DOT to me. Look, here's the problem with mental health. They rolled this thing out. They didn't think about it. Easley said he's just a banker. They lost millions and millions, $400 million with Les Merritt, his latest audit. God bless Les Merritt. And you know, now they don't know what to do. They're standing around, you know, with their finger up in the air, seeing which way the political wind is going to blow. What you need to do is reassess where you are with delivering needy services to every single county and every single needy person. Because we've had too many folks wind up in the criminal justice system, which is an indicator of a failure of mental health. I think we're paying too much money on the reimbursements on those who have a lesser degree of disease and not enough on those who have a greater disease, need of disease. And we do not have enough long-term care beds to take care of alcohol and drug and substance abuse. We need to expand and at least maintain that for a growing state. So it's a difficult area. I've met with the people. We need to get on this immediately.
I spoke with one lady that worked within the mental health system, and she was telling me that there was like 800 companies now, or individuals, or small people that was bidding for the clients. And she was saying that where they used to have one supervisor would have like 10 clients, they now are trying to get one-on-one at $60 or $61 per hour, and they're just sucking money out of this system as hard as they can. It would work fine under state control, if it could go back to the state control totally, if you had the right leadership up there with common sense.
Mental health reform in this state is the picture child of poor leadership and poor execution of the plan. That plan was well intended, but it was poorly implemented. We did not have the systems in place to place all the responsibility down on the private enterprise system. I think what we've got to do is be sure that we clearly state what the state's role is. I believe which should be long-term care, what the LME's role is, which is short-term care, and the role of the private sector, so that we understand what they're supposed to do, tell them what they're supposed to do, pay them for what they do. I think that I disagree totally with the regional approach. I've talked to county commissioner after county commissioner who said, Fred, we had a good mental health system in our county. Then Raleigh started telling us what to do, and it all got messed up, and our people are hurting. We're wasting millions of dollars. I think most counties can do the best job, and the ones that can't, we just need to, then we'll have a regional approach.
Justice Orr.
I think the mental health so-called reform is maybe the worst scandal that I've observed in my 35 years of being involved in government in North Carolina. It's been a huge waste of money, as we know. We've seen many lives negatively impacted by it. And frankly, I'm suspicious of the Mercer report. That specific recommendation might have some merit, but I know that Sand Hills mental health here in this region didn't go with some of the requirements that the state was pushing, and as a result, actually has done a far better job than most of the LMEs around the state. And yet the Mercer report ranked them as one of the lowest ones. So I have great suspicion quality of this Mercer report. And finally, I think we literally have to start it. We've got to get a new mental health plan for North Carolina. We've got to get families and providers and professionals working together to make it work.